Moi, je parle français. C'est mieux si je parle français pour vous, je
Ok,
crois.
pas de
Bah,
souci.
normalement, nous, on a à peu près 18 étudiants qui vont venir.
Hmm.
Et après, nous, on est toujours à attendre les autres.
Mhm.
Mais après, de toute façon, on va enregistrer et on va publier sur Insta, sur TikTok, sur YouTube s'il y a des étudiants qui ratent le Zoom.
D'accord. Vous publiez en ligne sur les différents réseaux sociaux?
Oui, c'est ça.
Vous envoyez pas par mail, vous mettez sur les réseaux. Ok, pas de souci.
Oui, on met sur réseau.
Et il y a une limite de temps
Pardon?
vous laissez de façon permanente ou s'il y a une limite de temps?
La bonne minute, il y a 10.
C'est-à-dire,
Une heure, je pense.
comment?
Une heure.
Non, je voulais dire sur les réseaux, vous laissez la présentation de façon permanente
Oui,
ou
permanent.
Oui, oui.
Permanent.
d'accord,
Et je fais aussi faire sur le Insta.
d'accord.
Udah gue streaming di Instagram juga kok, Beb. Coba cek.
Ini ada stream. Ada muka
Udah,
gue.
ada.
Gak ada anjir.
Ada. Refresh IG-nya.
Oh iya, ada muka gue. Bon, bah là, maintenant, on fait le live streaming sur Insta.
D'accord.
Ini kita masih mau nunggu atau mau gimana?
Mulai aja kayaknya.
Je crois qu'on peut commencer alors que vous ne travaillez pas trop tard après. Vous finissez
Pas
pas
de
trop
Oui.
souci. Je vais essayer de partager mon écran. Alors, est-ce que vous arrivez à voir? Je vais mettre. Hmm, attendez. So, hello everyone. So my name is Ines. Today I will present you the health system in France. And so first, before we start, you can scan this QR code. This is a survival kit. Uh, Thanks to the survival kit, you will be able to have more information about administrative procedures, and so more information about housing, health insurance, everything. If you have questions, you can also then ask questions because you will be in contact with someone from the SMERRA who will be able to answer all your questions. So it's very useful when you just arrive in France. So I'll let you scan it. And at the end of the presentation, you will be also able to scan this QR code. So I will pass and we will begin. So welcome everyone. So the SMERRA is a mutuelle, so a compulsory health insurance for students, which we will see what it means to compulsory health insurance. We give solutions to students in terms of insurance and compulsory health insurance, and we are very active in the student's life. So first we will see in France how my health expenses are organized and how the health system in France works. So France is known as the best country when it comes to healthcare insurance, and students benefit from a personal cover with the French health insurance. So the social security will refund a part of your medical expenses. So l'assurance maladie, also called CPAM, will be the one who will refund your health expenses. So when you just arrived in France, you will have to register to get a social security number. If you stay, for example, 1 or 2 years, it's better to get a social security number. And you need to go on the website étudiant-étranger.mli.fr. It's the website for foreign students that are outside of the EU. And then you'll be able to ask for a social security number. You need to fill a form and send documents. So you can take a photo of this example, but on the website you will get all the information needed to subscribe for social security number. So how does health coverage work in France? So first, for example, I go do a checkup with the doctor. I go see a doctor. I show him my carte d'identité, so vital card. Then I get reimbursed by the Social Security, but I will get reimbursed by the Social Security only 70% of this checkup. And the 30 remaining percent, if I don't have a mutual, I will have to pay by myself. So if I have a mutual, so it's compulsory health insurance, then I will get 100% coverage. Without a mutual or compulsory health insurance, it doesn't. You will only be reimbursed 70%, so by the Social Security. So it's how this hybrid system works, and all healthcare is automatically reimbursed by the Social Security. It's very important to know. So let's see a little example. So for example, Sam felt ill, and when he woke up this morning, so he felt ill when he woke up this morning, and he went to the doctor. So doctor appointment is 30 euros. So you will get reimbursed 19 euros out of these 30 euros, so the 70% by the Social Security. Then the 9 euros, so the 30 remaining percent, if you have a mutual, will be reimbursed by your mutual, so your compulsory health insurance. If you don't, then you will have to pay these 9 euros, and there's always a 2 euro flat rate contribution. So these 2 euro are mandatory to pay. You will have to pay these 2 euros. So that means if you don't have a compulsory health insurance, you have to pay 11 euros by yourself. Another example, so for example, if you felt ill, you have a stomach ache. So for example, like you had pain in your abdomen, and then you were you were taken to the hospital. So when you're hospitalized, the total cost of a hospital stay is 1,700 euros. So 70% are refunded by the Social Security, so 1,360 euros. And the 30 remaining percent, if you don't have a mutual, will be paid by yourself, so 340 euros. So that's a lot when you're a student. You just came in France. So it's very important to know that Social Security doesn't reimburse everything, especially for hospitalization. So, and including the 20 euros per diem allowance that you will have to pay if you stay. So let's see about a little bit about the general practitioner. So the general practitioner, it's very important to know that you need to get to ask your general practitioner if it can be your permanent general practitioner, and you need to tell the CPM that you have a permanent general practitioner, so that you get consultation faster, and you need to find one that is next to where you live, and you get a better refund, so a better coverage, and you be better reimbursed if you get a general practitioner, the same general practitioner that you have told the CPM that you had the general practitioner. So you have to say to your CPM that you already have one. And you can also make an appointment with your doctor in the form of a teleconsultation. And you can do that also thanks to Doctolib. So it's a very important website where you can take an appointment with a doctor, and you can take a teleconsultation or a physical consultation. It's the easiest way to take an appointment with a doctor. So I recommend you to write down Doctolib. So it's just here. So how I get refund? So if you have presented your vital card, as we said before, your appointment fee will be refunded directly to your bank account. So it's really important to register your IBANs or IB, as we said in France. So details in your personal page before attending your doctor's appointments. If you have not received your vital card yet, you will need to fill a treatment form. So the treatment form will be given by the doctor, and you will have to sign it and send it to the CPAM, so to your CPAM. So it's very important to know that you have to sign and send it to get refunded. So for example, if you have a medical prescription by your doctor, when you have bought your medicine from the pharmacy, you will need to send your treatment form and a copy of the prescription for a refund if you have not presented your vital card. So the prescription plus the treatment form you will have to send to the CPAM. So how do I get my vital card? So after your registration, the CPM attributes you a temporary social security number, so NNP. So to obtain it, to obtain a definitive number, so social security number, and receive a vital card, you will have to drop the following documents in your personal space. So the complete copy of a birth certificate translated in French and certified by a certified translator. It's very important. So an extract of your birth certificate, a copy of your family report, marriage certificate if you are married. You will then receive a photo form to complete and sign in order to obtain your vital card. So the vital card will be sent after you get your temporary number, so social security number, and you have to ask for the vital card. Usually to get your social security number, so temporary social security number, it will take between 1 month to 3 months. And to get the vital card then will take 1 month. So 1 month to 3 months, but usually 1 month. So now let's see the useful contacts. It's always very important to know which so the very important contacts in France, for example, the 15th for the ambulance service, the 17th for the police, fire brigade 18, 112 for the emergency number from mobile phone in Europe. So you have also our number you can call if you have any questions, for example, if you have subscribed to SMERRA, and the CPAM number, which is the 3646. And something really important, for example, if you are working and you have a workplace accident, you need to inform the CPAM and your university within 5 days. So you have to know that. And if you have another kind of accident, so personal, third party, you have to be declared to SMERRA if you are in SMERRA, or to your mutuelle, so country health insurance, or CPAM. So SMERRA, who are we? So as I said before, we are very active in the student life. We designing health and insurance offers adapted to students. We have about 60,000 members. We offer solutions like community health insurance, civil liability, home insurance, so etc. etc. We are very active, very developing prevention and health promotion also. We are also have partners like partnership with Logifac and Facabita, which are residences that have 18,000 homes in all of France. So if you are searching for an accommodation, we can help you also. And we have also different offers that are especially designed for international students. And we have a service, so for international students, that is called Student Call France. So if you want to take photo of the number, so with this number, you can have someone who can speak English and can help you with your accommodation issue, or if you have any questions about housing assistance or insurances or administrative purpose. So you can call this number if you have any question about a health system, so the French health system, or anything. We are here to help students, and it's free. And when you just arrive, we created packages, so Pack en France, we call them, which are designed for French students that do not have yet a social security number. So Pack en France Global, you can take it for 3 months maximum. So it's the maximum period, like the maximum you can take it, because you can wait maximum 3 months to get a social security number. And in this package, you have comprehensive health insurance. You're covered 100% if you go to the hospital, or if you need to consult a general practitioner. You also have civil liability insurance in it, which is mandatory if you're going to university, or if you have an internship. So if you already have it, it's just a plus. And you can take this package right now if you want. There is a QR code if you want to see more about it, or if you want to subscribe. So Pack en France Global is the insurance you can take before getting your social security number. We have Pack en France Confort on the left, which is a package you can take after getting the social security number. And if you're staying less than 1 year, if you're staying, for example, 6 months or 1 year, and you have a social security number, you can take this package for the amount of time you want. And there is everything. There is a community health insurance, civil liability, and assistance. So if you want to have everything in one package and not take like just a community health insurance, civil liability, and you're not staying long, it's perfect for you. So if you want to scan, you can. And at the end, if you want me to come back, I will. So as I said, if you're not working or doing a paid internship, or you do not have a CAM, so EHIC, so you can take the Pack en France Global. So now we're going to see the insurance or civil liability, which is mandatory. You must already have it, or maybe you would get one. So it's an insurance that is mandatory, as I said, for your school, internship, university. There is in the first one, so the most important, the all important, the civil liability and personal injury, you have legal action and assistance. And in the second one, the safe and secure, you have the same thing, but plus internet risks. If you don't have a civil liability yet, you can take it right now if you want through this QR code, or just go on our website and learn more about it. And if you want, compare the one you have with this one, which is pretty complete and allow you to be covered. So we also have a back rentrée, so for a back to school pack. This pack, there is a 2 months so free for offered, plus a solidarity exam insurance offered. and you have civil liability also in it. So plus compulsory health insurance, and it's available until the 31st of October. So if you get your social security number before this date, you can take it. The prices are very attractive and pretty low for this kind of packages, and very interesting for students. So now we're going to see the different plans we have for compulsory health insurance. So we have the minimum, which is the one you can take if you only need a compulsory health insurance to be covered for hospitalization. So you'll only be covered for hospitalization in the minimal. We have the essential. In the essential, you'll be covered for hospitalization and general practitioner consultation. You have also blood test. You can be covered for radiology and from medication. And in the comfort, you're covered 100%. You have medical care, so dental care, optical care, and also hospitalization, and all I said before. So it's a complete plan. And the all risks, so twist, is the one you can take if you need to see for example, a specialist to be covered more than 100%. So this one covers you 130%. So if you want to see more about it, there are different QR codes if you want. So we have 4 plans for every needs and everyone. And we also offer housing insurance. It starts at $345 per month, and you can take it anytime. If you need a housing insurance, you can take it for today and have it today. That's the advantage of this insurance, and it's for students, of course. So to contact us, it's very easy. Once you subscribe, you will get this personal page, and you can send us emails, and you can also contact us by phone with this foreign language line. So as I said, we have the student conference, which is an international service, and you can write to us very easily, and we're very available by phone or email. So we already saw this slide. And here are some useful websites. So as we saw before, Doctolib, to get an appointment with a doctor, so general practitioner. There is also annuairesanté.amélie.fr. It's a list of healthcare professionals and facilities. So there's all the professionals that are near where you're living. So you can find everything on Annuaire Santé. You have also our website if you want to go see our website, and the Social Security website, and also the Social Security website for foreign students. So étudiants étranger.amélie.fr. And here is a very useful YouTube channel, which is called Campus France. You can find tutorials, you can find different videos that can help you with your administrative work, and if you need to open a bank account in France, how to do it, how to fill, for example, a treatment form. Everything is described on this website, so on this channel, and there are different videos in different languages. So if you need more help, also you can go on this YouTube channel. So to finish, there is also the glossary of terms. So terms that you will hear a lot in French. So for example, mutuelle, which is community health insurance. So if you want to take a photo, it will be very useful for you, because these are terms you learn hear a lot, and to have a definition and a translation, it's better because usually in France people talk just French, so it's really helpful to have these translated. So there are other words like carte vitale, so tiers payant, for example, third-party payment, feuille de soins, treatment form, and frais de soins, so health expenses. So I will let you take a photo if you want. And at the end, if you want me to come back, I will. So thank you very much for your time, and I hope it was helpful. I hope it was clear. If you have any question, feel free to ask. I'm here for that. Thank you. And I will let you scan if you haven't yet saw the survival kit to get more information about administrative procedure if you have questions about housing and everything. So yes.
Thank you so much, Ines, for this beautiful presentation. Uh, yeah, I understand there's a complicated system in France, about especially for the health system.
Mm-hmm.
And now we have one question from the participants.
Mm-hmm.
The question is from Krista Geraldine. Hi Ines, I have a question about making a doctor our GP or primary care physician. I
Mm-hmm.
realized that on Doctolib, a lot of doctors state that they do not receive new patients. It's already written in their Doctolib page.
Mm-hmm.
Therefore, I hesitate to go to a GP because I might need to find another one to be my GP if they refuse. The question is, how do we best choose a doctor to be our GP then? Thank you in advance.
No problem. So, yes, on Doctor, they usually say that they don't take new patients, but it's better to take an appointment with the doctor that is near where you live or near your university, for example. And you can ask them during the consultation. You can do that. If they say no, so you have to find someone else. If they say yes, it's better for you, but it's not that easy, I know, but it's better to ask during the consultation. You can ask, like explain your situation, that you're a foreign student, that you really need a general practitioner, and to get to be fully covered and get a full reimbursement. So sometimes they will agree, and sometimes they will not. But there are a lot of doctors, so I mean, you have to try to find one not so far and that will accept. Um, so yeah, I can't give you more advice than that, but I wish you good luck also because it's not that easy, I know. Is there another question? I think excuse me, I don't hear you because the microphone is cut.
Yeah,
Yes.
sorry. So thank you for your answer. So, it's better to ask directly during the appointment. That's what you say, right?
Yes. It's always better to ask during the appointment so that you can explain your situation and see if it's possible. Because on Doctolib, it's something they write and then it stays permanently. So it's better to see directly with the general practitioner when you have an appointment with them. But if you
Okay.
find on Doctolib someone who didn't wrote that they are not taking new patients, that's better. But if there is only a general practitioner with this written on Doctolib, then and you can find other general practitioners that are not on Doctolib on annuairesante.amelie. So I invite you to also search on that.
But the good option is we can find a general practitioner near to our apartment or near to our
Yes.
university, right?
Yes, it's always better because if you're ill, you're really sick, you don't want to take the bus or go very far to see your doctor. You would prefer to have your doctor not so far because you will be in a state that will not allow you to travel a lot. So
Yeah, thank you so much for your answer.
no problem.
If you guys still have any question, okay, there's another question again from Krista. If we are receive a specialist care from our home country and need to continue medication, the specialization doctor letter and the specialist doctor letter available. The question is, what is the procedure to get this medication in France? Can we go through any general practitioner first, or do we go to our specialist directly?
So that's a really good question. So in France, there is this system. You have to go see the general practitioner first, and he will give you he will send you to a specialist. So you always have to go see a general practitioner first, and then you will see your specialist, never the specialist first. So that's why it's very important to have the same general practitioner, especially when you have a condition or illness, so chronic disease, for example. It's very important to have your general practitioner so that he will send you to the specialist and you will be able to work like this. So I hope it was clear, but yeah, general
And
practitioner first and then.
okay, thank you for your answer. So, so we should go to general practitioner first. But if we already have our own general practitioner, is it better to go to our own general practitioner first, or we can go any general practitioner that we can choose?
If you don't have a general practitioner that is assigned to you, you haven't find one, you can go to any general practitioner. So you can go to anyone. If you need to go to see a general practitioner tomorrow, for example, you can, and then he will send you to a specialist. So that's not a problem.
Okay, thank you for your question. Yeah, that's an interesting question. Because I also have experience like that. But I think it's not all specialists that we should go see a general practitioner first. I think for like the the ortho, I mean for the eyes.
Yes, yes.
If you need the glasses, I think you can
So
go directly, right?
kinesiothérapeute, or osteopath, all that, you
Osteopath.
can see them first without going to see the general practitioner. It's called médecine douce. So it's not for it's for your better health, so for your body to feel better, for your muscles. So it's not a heart specialist. It's not something um, to do with, I don't know, your brain, your heart, a condition that you have more inside. It's more like the doctor that takes care of your body, for example, that will you can see them without having to go see the general practitioner. Or for example, your guy gynecologist, how you say that?
Yeah, gynecology.
Yeah. So you can see them without having to see the general practitioner.
Yeah, and for the like if we need eight glasses like that too, right?
Glasses, you have to see the ophthalmologist, so the one who will make the eye consultation. So there is a special doctor for that. And then, yeah, for example.
And there is another question from Krista.
Mhm.
What kind of care do we get at an infirmier? It's surely not the same as doctor because they are nurses, but is it limited to emergency care?
So if we go see une infirmière,
Infirmier, infirmier.
yes. So you will see nurse when you go to the hospital, or if, for example, you had a small surgery and you have to go see a nurse. So they are private nurse; they have their own local, so you can go see them. But it's in a very special situation. So it's not something usual to go see a nurse. Usually you see a general practitioner, you go to the hospital, but you don't see a nurse for a specific you go see a nurse for a specific reason. So for example, you had an injury, you have stitches, or but in other reason, no, you don't see a nurse. I hope I answered it well. I don't know if it was the question, but okay.
Okay, thank you for your answer. Actually, for me, I also have a question. I have experienced like go to dentist, but
Mm-hmm.
I need to like to solve my dent. I had a dent that I need to fill like there is a hole in my
Mm-hmm.
dent in my
So
in
caries,
my
for
teeth.
example.
Yeah,
Mm-hmm.
carie. Yeah, like
Mm-hmm.
that. But they they asked me it's around 1,000 euro, and it just cover like I need to pay again around 100 euro, and I don't know, I already have some mutual, but I don't know why I still to pay more for the dentist in here.
So probably because your mutual is only covering 100% and that you have external fees. So that means it's the treatment and everything costs more than the conventional price that was set by the Social Security. So as I said before, for example, for consultation, it's 30 euros, but so for doctor from sector one, I will come back to that, but for doctor from sector one, it's 30 euros because there is they obey the price of Social Security. But there are doctors from sector two that will apply free tariffs, and it will be, for example, 60 euros for them. So double the price of the Social Security. So when I go see a doctor from sector two that has the double of the price, I need a 200% coverage because it will be twice the price. So, for example, for your caries, so what happened with the dental, so the dentist, maybe you had external fees, so extra fees, and that's why your mutual is not covering totally. But what is important is that before having a procedure or so operation, for example, you have to send we say devis in French is like you have to send a paper like to your mutual to know how much you'll be covered, how much you'll be reimbursed before starting the procedure, starting the anything. It's always better, for example, for your glasses also to know how much you will be reimbursed. Because 100% doesn't mean you will be reimbursed 100% on the total that you paid, but it's 100% of the Social Security price. So that's really, really important to know. I
Ah,
hope
yeah.
it
So,
was.
so before we take the action, we can choose like we can take it or not, and we can know how much we spend for that
Yes.
operation, right?
Yes, yes. It's always better to be cautious and ask the mutual first.
Okay, we have a question again from Gabriela. My friend had an experience that she didn't have the card vital and her condition was urgent. Can we go to the emergency without card vital? Because she tried to call all the hospital that time, but they didn't receive the patient without card vital.
So it's very complicated, but you can go to the hospital even if you don't have a card vital if it's very, very important. There are also emergencies in your university. I don't know if in your university you know, but usually you have uh, health center where you have doctors and you can consult them. if you have anything, and usually it's free. There are also websites where you can find solutions for health and medical care that are free for foreign students. So, I mean, even if you don't have the carte d'identité, you can go to see you can go to hospital. The problem is that you're going to pay everything. Is that, and you can go to a private clinic, or but the problem is that you're going to pay. If you have an insurance from home that covers, that's not a problem. So, for example, if I go to, I don't know, United States, and I don't have the social security from there, it's not a problem. I can have my own insurance and be covered. So it's not a problem. If it's an emergency anywhere in the world, you can go to the hospital. I hope I was clear.
Yeah, thank you so much. For me, I think I also have a question. If, for example, if we want to take an internship such in another country or another European country,
Mhm.
how do like how can we do like in the Amelia? Is there any system that cover our internship like that or?
Another system that covers you mean in terms of health?
Yeah, in terms of health, like
Yeah.
if we want
Uh,
to go to take the internship.
so I'm sorry, I'm just seeing that I'm getting low on battery, but I have to charge, but I'm going to answer very fastly. So if you have the Social Security, you can get the EHIC, so the European card, and go to Europe with this card and be reimbursed like the 70%. And you can get an insurance from France when you have your Social Security. So that's not a problem when you go abroad, and you can be covered for your internship, of course. And we have also solutions like this, like packages for students that want to travel abroad for the internship, or just to travel in the world or in the EU. So yeah, there are solutions to for students that are doing internships on.
Okay, thank you so much.
Thank you.
Maybe do you want to charge your
Yes,
laptop first?
I will just come back with my
Yeah,
charger if you have other questions.
yeah. We will wait for the others if they have a question. Buat teman-teman kalau ada yang mau ditanya lagi, tulis saya di komentar ya.
Ini kita bakal bahas soal apartemen atau enggak ya?
Itu ada sih kayaknya di apartemen tuh di listnya dia ada housing terus apa lagi itu tadi. Gue mau tanya juga sih soal apartemen. Kalau teman-teman ada yang mau tanya soal apartemen, tulis aja ya.
By the way, tadi tuh ada, aku nggak tahu orangnya ada di sini atau enggak. Cuman ada mahasiswa yang nggak dapat apartemen di daerah Ekuli.
Mungkin bisa tanya.
Sorry, I'm back. Sorry.
Yeah, it's okay.
So I haven't seen if there were other questions or was
Maybe there are some question from me about logement, like apartment. Right now, there are some students from Indonesia that I just come in Lyon, but they still cannot find accommodation in here. It's very hard for them to find accommodation. Do you have any suggestion or something like that?
So we have two partners. So it's Logifac and Fac Habitat. They are residences. They have residences in France and in the south and north. I don't know where you're located, but or are they all from different cities?
Yeah, they are all. In
Okay.
fact, they are all in different cities. Yeah.
So on the website, SMERRA website, you can find the Logifac and Fac Habitat. And also, if you had scanned the kit, survival kit, you can ask for accommodation help because Student Conference help students to find accommodation. Right now, it's very difficult because everyone is asking for an accommodation, especially in September. But in October, they will have more accommodation available. So that's why we are still working with students to try to find accommodation for them, so they can apply for a resident in any residences next to where they are going to um, study. So I suggest them to go on Logifac and Faculta and file a form and choose a residency and see if there is availability and yeah. But I don't have like the magical solution, but that's what we can do. We can help them like find something, but sometimes there are no availability.
Yeah, thank you for your answer. I've also a question about living assurance, like the assurance that asked by the landlord before we enter. If we already enter the apartment or the accommodation, and there's a problem like water draining or the lamp on or the fire sensor, is it always covered by the assurance, or we should solve it by ourselves, or
Usually it's covered by the assurance, sorry, insurance. We offer also housing insurance, and it's covered in these assurance that we offer. Usually it's covered in every assurance. So it's called multi-risk. So it's the housing insurance. So it means multi-risks. It's supposed to cover you if there is a flood, if there is a fire, for example, or natural catastrophe. So it's supposed to be covered. If you're someone broke to your home and takes something, it will be covered for that also. You have to also read carefully the guarantees, so the option of the assurance that you're taking, because in some assurances you will not have some guarantees, some specific guarantees, but the basics should be in every multi-risk assurance for housing insurance.
but what is the difference between the assurance and the garant?
So garant,
Yeah.
a garant is so it's a warrant in English, I think. It's
Yeah.
the one who will assure the residency or the landlord that if you can't pay you can't pay every month, if you can't pay, they will be able to pay for you. So they are here to secure to assure your landlord or the residency that at the end of the month there will be the payment. So there will be a payment, and so that's what garant and why a garant is very important. And a physical garant will always be preferred by residencies. But for example, with Student Corps of France, we can push foreign students application to be choose over another that has a physical garant, even though they have a garant mis or visal, which is a garant you can take online. So that's what we can do on Student Corps of France and help students get an accommodation easily. I mean, faster.
Okay, thank you so much. Thank you for your answer. If there is someone who wants to ask, maybe it is your last time.
Okay.
If there's no one again wants to ask a question, maybe we will close our session today.
Okay.
Yeah. Thank you so much, Ines, for this beautiful presentation and your answer to all of the questions that we asked to you. Good luck for your job and everything. Thank you so much.
Thank you very much. I hope it was helpful. I hope you learned more with this presentation. And
Yeah.
if you have any questions, we are available by phone or email. So don't feel free to ask questions and come back to us and see solutions that will be better for you. And we can also help you with other stuff than just health, but for example, accommodation. And if you have a question about French administrative work, so you don't just feel free to ask us. We're here for that.
Thank you.
So thank
Bye-bye.
you. Have a nice day.
Have a nice
Merci
day.
Inès. Bonne
Goodbye.
soirée.
Vous aussi.
Lu udah matiin live, Cis.